Continuing the atopic dermatitis overview. So it's a chronic inflammatory skin disorder characterized by pruritus, dryness, erythema, eczematous lesions, deficiency of the filaggrin gene, ceramides, and natural moisturizing factors, leading to a significant transdermal water loss and epidermis, affecting 10 to 20% of children, globally persisting in adulthood, face, scalp, flexural areas, hands, feet, associated conditions or skin microbiome dysbiosis, allergic rhinitis, asthma, and food allergies also. So the immunological mechanism in AD, cytokines and immune response involved are Th2 predominance, response of the interleukins of IL-4, IL-5, IL-13, IL-31 associated with pruritus, also IL-17 and 22 contribute to chronicity and skin barrier disruption. High IgG levels may indicate systemic inflammation, especially food sensitivity. Elevated IgI levels in 80% of the patients indicating hypersensitivity reactions in AD, also in acute phase of the disease. So what are the exosomes? I'm pretty sure that every one of you know what are the exosomes. They are a very small extracellular vesicles derived from multiple cells with conserved biomarkers on it, diameter 30 to 150 nanometers, important mediators of intercellular communication. It contains multiple proteins, lipids, and nucleic acids like mRNAs, miRNAs, inRNAs, and circRNAs that regulates proliferation, differentiation, migration, and apoptosis. They can also modulate inflammation, angiogenesis, fibrosis, and tissue regeneration. Sources are human, animal, and plants. So what we expect from exosomes in AD? Exosomes derived from plants, that's the exosomes I use on my patients and allowed it here in Brazil. The role of exosomes in AD is to suppress the pro-inflammatory cytokines, especially the interleukins 4, 5, 6, 31, the tumor necrosis factor alpha, enhancing skin barrier repair via keratinocyte proliferation, modulate the immune responses to restore the Th2 and Th1 response balance. So plant-derived exosome can increase collagen synthesis, which has been proved by a variety of scientific publications. So the roles of exosomes are biocompatible, minimizing the risk of adverse reactions comparing to synthetic or animal-derived treatments. This is a case of mine, a case report of atopic dermatitis. She's Melissa, 33 years old. And when it started in childhood, primarily affecting parts of her body, and in adulthood, after an emotional trauma, it worsened on her face. So symptoms were redness, itching, psoriasis, cracking skin, rhinitis and asthma related in concomitance with skin conditions associated with a lack of sleep, depression, and fungal syndrome. Despite of all conventional treatment, corticosteroids, belostine, cyclosporine, it has shown no significant improvement in her skin. So we started with the Exosome Therapy, microneedling. We did 4 sessions in an interval of 15 days. And I'm showing here for you guys to see how I manage the microneedling, like always horizontal or vertical, never circular movements. And when you start to see a pimple of blood, you stop it to make sure that all the exosomes can penetrate well on the skin. At total, I did 7 sessions, and I'm going to show you why. So after these 3 sessions, we can see a little bit of improvement, but not so much. We can see that the dryness got better, the redness still exists, and she complained about the itching. So I decided to see laboratory findings on September. Then we started treating her on July 2024. So September, with this laboratory findings, we can see that high levels of IgA was very, very high. Vitamin B12 very low, and also the vitamin D3 very low. I decided to treat her in agouti skin axis because we know that so many factors plays a role of importance into health and beauty of the skin, including genetics, epigenetics factors, the microbiome, and the lifestyle habits. So nutritional immunosupport, I decided to modulate the gut microbiome with prebiotics and probiotics, and a dietary assessment with no sugar, no lactose, no gluten, a rainbow diet, fruits, vegetables, fibers, and protein. And oral supplementation. I associate vitamin D3 with vitamin B complex and other vitamins I'm going to show to you. The vitamin D3 that we know that plays a role in modulation of proteins required for skin barrier function and regulation of the innate immune system. Evidence suggests that a deficiency of vitamin D3 contributes to skin inflammation also. Vitamin B complex are crucial for maintaining healthy skin, including cell regeneration, improving hydration, helps managing inflammation, supporting the skin's natural barrier function, protecting against environment damage that is crucial for the individuals that suffers with AAD. So my protocol of anti-inflammatory immune support was high doses of vitamin D3 in the first 30 days. So I started with 20,000 international units, and then I lowered the dose to 2,000 units per day. But I always associate the vitamin K2 because it's a mediator, and the importance of associating this vitamin K2 is due to the higher levels of vitamin D3, and that we make sure that the calcium goes directly to bones and not finding floating in blood. So just a second. Here, glutamine. Yes, I also administrate glutamine 5 grams per day in the morning time, plus omega-3 fatty acids. The oral administration and dosage of B vitamins were vitamin B6 that helps with inflammation, the vitamin B9, methylfolate supports cell renew and repair. It also helps in the synthesis of DNA for healthy skin and cell function. The vitamin B12, methylcobalamin supports oxygen and nutrients for the cells, helping dryness, inflammation, and hyperpigmentation. And make sure that all of these complex B vitamins are done in the methylfolate or methylcobalamin. And the skin treatment topic use, I administrate on her vitamin E, 100 international units, transdermic biolipids nanotopic cream, once in the morning and once in the evening, and during the daytime, thermal water for hydration. So after the oral medications and all the dietary assessment, we could see a very nice improvement in her condition. We can see the redness. The first photo, the color is not so good, but we can see clearly in this photo that the redness and the condition of hydration and elasticity improved so much. Results of after 6 months of treatment. So anti-allergic bilastine was taken 3 times by her. Corticosteroids, no more use since we started the treatment. We saw the cutaneous barrier improvements, elasticity, as I said, and hydration. So this was before and after. We can see the video. It was really impressive. Also, the color of her skin. We have more findings here. So we could see that the first exams, laboratory findings on November 2024 versus January 2025, we can see the levels of IgA was incredible, decreased, and the levels of vitamin B12 also very, very good. for immune support. Also, the vitamin D3 has improved. I try to make not more than 80 of levels of vitamin D3. Those are more complete blood counts that we found out that white blood cells were very high, 9,000 we can see here. And January, we found out that these levels was normal. And so this is the before and after. We can not see any more dryness or cracking skin on her face or other parts of her body. So this is the eyes that was the most affected area. So this is the result. So challenges and future. Needed for standardized exosomes formulations and protocols. That it's so difficult right now to have it. We need more studies. Future directions. So the exploration of novel combination with emerging nutraceuticals, of course. Reevaluation of individual protocols of vitamins, blood tests, evaluation every 2-3 months. That's what I do to all of my patients. I used to reevaluate them every 2 or 3 months with laboratory findings. So Exosome Therapy offers an effective approach in AD management by addressing both inflammation and skin barrier dysfunction, especially in inflammation and redness. I realized that this exosomes works very good. Nutritional supplementation approaching the gut-skin axis enhances systemic immune modulation and improves patient outcomes, especially in autoimmune disorders. That is so important. And a personalized integrative approach is critical for long-term success.